So today I've got the wonderful Amanda McGregor with us today, and we're talking all about the Bowen technique. So we're going to start off, Amanda, with what is Bowen? How would you describe Bowen?
Louise, that's probably one of the hardest questions to ask a Bowen therapist because
Yeah,
it is quite difficult to explain briefly, really. But I guess it's a remedial therapy, so we're kind of like looking to sort of help somebody cure somebody, although obviously we're not allowed to legally say that. But it's a remedial therapy, a hands-on therapy, so actually touching the client, and a very gentle therapy. And it came originally from Australia, from a man called Tom Bowen, who had a cement factory in Geelong, Australia. And he had a lot of workers, and obviously it was quite heavy work, and they ended up with lots of aches and pains and taking time off work. So he obviously had very sort of hands that he could feel what was going on, when he basically sort of had his workers that he would say, right, come and get on. He had an old bed in an out shed, and just used his hand and made some gentle moves over with the body, and kind of felt his fingers would feel the response by muscles, tendon, ligaments, and where they sort of released and relaxed, and then these people would get up and say, oh, well, yes, that feels looser and better. And that was very basic where it started. So that was back sort of in the 1960s. And from there, it came over to the UK really in the 1980s. But I trained 14 years ago now. And so when I first qualified, really not that many people had heard of it. And I would say it's only probably in the last 5 years that a lot more people have heard of it. And to the extent a lot more sort of people within, in health and well-being. So physios, osteopaths, chiropractors, even we've had some doctors, consultants that have done, which is quite amazing, really.
yeah.
But we've done quite a lot of research, or a gentleman called Julian Baker, who's the director of the college at Bowen Studies, has spent the last 5 years doing a lot of research as to how it actually works. So to make it credible, and his aim is to get it out there, in hospitals and with GPs referring. And he's done a lot of work with King's College Medical School, the University of Krakow, and one in America and one in Barbados. And he's done a lot of human dissection and research on fascia, which has been the buzzword out there, really, hasn't it, for the
It
last
has.
two.
So let's just backtrack just a little bit. So you said it's hands-on, it works on the body, but it's not massage as most people would understand massage, is it?
No, exactly. So sorry if I went off on a bit of a
That's
tangent,
right.
but I just wanted to kind of explain sort of where it came from, and the fact that it's working very specifically on the soft tissue, on muscles, tendons, ligaments, and key thing, that very important thing on top, fascia.
Yeah.
And we make very gentle rolling movements over specific muscle, tendon, and ligaments, or groups of. And it's what we call a disturbance that we make, which is then picked up by the nerve endings, and basically connects the disturbance, sends the impulses up to the brain to register that there has been a disturbance, and basically for the brain to process it and send a response. So it's that kind of making that movement, sending to the brain, registering, and waiting for the body to then respond. And again, it's very light touch, so that we're not actually instigating a move from the body. So we're not making a manipulation. We're just doing this very gentle movement, which then allows the body to do what it needs to do.
Very powerful.
But yes, I mean, very powerful. I think it's quite difficult sometimes for for clients coming in to get their head around the fact that it is very gentle.
Yeah.
And also the fact that, which is a big part of Bowen as well, is the breaks that we leave between some
Yes.
of the, and if you don't actually explain to your client that you're going to leave these breaks so that your hands aren't going to be doing anything, and times where we actually leave the room as well, and the point of that being that it allows the body to respond and we're not making that change. And yes, you have to explain that, because otherwise people just think, well, where's she gone? Or where, what they're doing? They're gone to make a cup of tea, having a glass of wine. What's, lunch? What's happening? But that is a very important part
Mm.
of the Bowen. Yes.
Mm. Really
And
interesting, and must be very difficult from a therapist or a client's point of view if they are used to doing a physical therapy like massage where you are manipulating the tissue. Yes, you're having some effect on the fascia, but manipulating the actual muscles, you can feel something's really happening, and it feels great, at the time. Um,
yeah,
but I think one of the things with massage that a lot of people have said, and I've experienced myself, is that you get the release at the time, but then there's no change in behavior for the muscles. There's nothing cognitive that's kind of gone on there. So this is much more powerful from the nervous system point of view, isn't it?
yes, and I think it is quite hard for them, because it, exactly, it's just like, well, what are you doing? And it doesn't feel as though you're doing anything. So for me, very much, my first experience of bone was when I had a long-standing lower back injury, and I was doing a lot of running, and running. I trained for the London Marathon, and reaching out, doing those longer runs, I could really feel my lower back playing up and painful. And the girl that I was doing the training, my running training with, had a friend who was training to be a Bowen therapist and was looking for a case study. So I remember going out and doing, a 14K run. My children were at school, and then thinking, right, okay, I need to go and pick them up soon, but going to have this Bowen treatment and lying on the couch and thinking, oh, what on earth am I doing? As if I've got time to lie here and all you're doing is a few tweaks, and how you can't be doing anything. And literally, I then was sort of forced back for two more treatments. But I have to say, it was then a month later, I ran the marathon and I had no problems with my back, didn't have any afterwards. And really, that experience was what made me come out
Mm.
of the NHS from my nursing and to go and train as a Bowen therapist. So I always do actually say that to my clients. And I actually say, you will think that you're lying here, I'm not doing anything. And I'll actually think to them that, you'll be there thinking, what am I paying my money for? Because again, at the end of the day, we all add up those pound notes, don't we? And think,
Absolutely. Yeah, yeah,
we
yeah,
oh
yeah.
no. So I always say to any kind of Bowen therapist, it's really important to say
Mm.
that to your clients so
Mm.
that they know what to expect. And
Yeah,
also, Louise, as you said, I think really important with Bowen, it's not a quick fix.
no,
So it might be that somebody leaves, and they actually, do feel as though you've resolved some of their issues, their pain or their tightness, but sometimes it can ruffle it up and it does sort of
yeah,
become slightly more painful, and the body has to work through that. And sometimes it brings out old issues that haven't been resolved previously, and you can suddenly feel a twinge or a pain somewhere completely differently that you just think, well,
mm,
that's really random, where's that come from? So
yeah,
I think it is really key to have that conversation with your client so that they know what to expect.
yeah. So when we're talking about fascia, I mean, it is a bit of a buzzword at the moment. It's suddenly become sort of a little bit more well known. When I'm teaching massage, always talk about this invisible jumpsuit that we have over between our muscles and our skin. And when I don't have vegetarians in the room, it's much easier because we can talk about the chicken that you cut up and that sort of that gooey, covery, skinny
Yeah.
thing being the fascia. Do you have a better way of explaining what fascia is rather than an internal jumpsuit?
Well, very strangely, I always, if anyone, if they're not vegans, or vegetarians, I always use the chicken
The
breast
chicken. Yeah.
with that peely offy bit, because I think that does really explain it.
Yeah.
But very strangely today, actually, the lady that's just left my clinic, she actually said she felt it was like she had a jumper on that didn't kind of wasn't in the right place, and she was sort of having to move her arms down the sleeve
Yeah.
and sort of pull the neck around. And I thought, actually, that's quite interesting as well. But it is very difficult to explain it, but I always sort of say it's that layer that sits on top of the soft tissue, and it's really important that you about hydration, because
Yeah.
if you are not fully hydrated, that fascia also
Mm.
sticks down onto the soft tissue and compromises the movement. So for me, I always do harp on about making sure that you're fully hydrated. And actually, I was just on a training course last week, and Julian Baker, the gentleman, the director of our college, was asking us then, well, tell me about fascia and tell me an interesting fact. And we were sort of all like, what are we going to say? And he actually came up with that fascia. All fascia is connective tissue, but not all connective tissue is fascia. And I was like,
Ah, that's a good way of describing it. I like that. I might steal that if that's all right.
oh.
So, what type of clients do you have? Do you have a specific client type, or is it just anybody in pain, or how do you promote your business? What does it do for whom? What problem do you
Okay,
solve?
so I mean, I suppose I have specific areas that I like working in,
Mm.
but generally Bowen as a whole is really good. Where it is gentle, it's great on babies. So my youngest baby that I've treated was 3 days old.
Wow.
I know, and that was a lady I treated during her pregnancy, because it's very good during pregnancy where it's gentle. And again, you can do it with somebody seated if you need to. But baby 3 days old, was born, very difficult birth,
Mm.
forceps delivery, and
Yeah.
had very tight neck muscles. Literally, probably I did a few Bowen moves for 3, 4, 5 minutes, and this baby hadn't settled in three
Yeah.
days.
Yeah.
And fabulous. This baby just all released out. So great babies, children's very good, because again, you can sort of move around the room with them. And I had a little girl up kind of looking out of a window, and you're trying to do the moves then, and you don't have to do much on children for
Yeah.
them to respond, so that's quite good. Great on the elderly, because again, it's very gentle, and it's great for sort of arthritis, and that kind of thing, and good to do a maintenance program with
Yeah.
those kind of people. And again, sort of maintenance program with people with fibromyalgia, ME, chronic
Yeah.
fatigue syndrome, however you want to word it, which is really good, and sort of getting them in maybe to do 3 initial treatments with a week apart, and then once a month or 6
Mm.
weekly, whatever. Great on sports injuries, acute pain. That probably is one of my favourites. And that's only just having had 3 boys doing lots of sports,
Yeah.
and I ended
Mm.
up doing that. And I think from my nursing background, which was in orthopedics,
Mm.
so brilliant on sports injuries. And then also great, I've had probably, worked with stroke patients. I think
Okay.
that's been the most amazing results. So I've had literally 3, and they were fairly youngish people coming in with, semiplegia, and literally from a wheelchair having to help up onto the couch.
Yeah.
And they haven't been able to have anything on the NHS. It was a 34-year-old lady, Romanian lady, and her husband had been coming to see me, and she had for a couple of sessions. They were both very stressed running their own
Yeah.
haulage business.
Yeah.
Went out to Romania for Christmas. She had a stroke out in Romania, which they did nothing for. So the husband brought her back to the UK where they live permanently, the NHS refused to do anything for them because she'd had the stroke in Romania. So he rang me, brought her in. So she had purely Bowen, that was it. And within, I was to say, she came in a wheelchair, and within 5 treatments, she walked in on sticks.
Yeah,
And yeah, for me, I think that was one of the most
yeah,
really emotional times where you just think, oh wow, I can't believe this. And then, we carried on doing treatments. 4 months down the line, she was back driving. She was then back to work. She had 2 young children. She did spend a couple of years really struggling with her arm and kind of nervous twitching pain in it. And that did take time to resolve. But I
yeah.
mean, considering she was in a wheelchair, couldn't do anything, fantastic.
That's so
So yeah,
rewarding, isn't it? Yeah, yeah. So if somebody wanted to become a Bowen practitioner, as you did, now you obviously had your nursing background. So did that help you? Was that a prerequisite that you needed to have some kind of qualifications before, during, after? How does the training work?
okay, so actually, when I trained then 14 years ago, and even now, they're saying to actually do module 1. There's 5 modules that you do, and module 5 is when you do your practical exam and a written exam, and you don't actually have to have your anatomy and physiology to do that. However, it is a recommendation that
Mm,
you do. And I would certainly suggest it is. And if you can do it beforehand, I think it really does give you a
mm,
much better understanding and grounding for what
mm.
you're doing. If you don't know what things, go where and whatever, it makes it so much harder to understand.
Presumably, as you go through the training, you're going to have to learn that stuff anyway. Otherwise, you're not going to be able to do what you do. Um,
No,
so,
and during the training, I mean, they're given 2 manuals
mm,
which show all the different specific Bowen moves that we do, and it does have some anatomy in it. And for tutors, then we're actually teaching that as we
yeah,
go along.
yeah,
But it really, you need to do a lot more, on that. And I know that they were then talking about, we just had a discussion with the College of Burn Studies saying about whether it now needs to be anatomy, physiology, and pathology,
yeah,
and that it needs. I know, Louise, we've done this
yeah,
discussion
yeah,
about making sure it's an accredited course,
yeah, yeah,
because I think it's afterwards it's so much better if you can join a professional
yeah.
body,
Mm,
that you do need to definitely have that.
mm,
So at the moment, they're saying you don't have to beforehand, but you certainly need to be doing it. Yeah.
mm. I suppose it depends on what you want to do it for as well, and what. Because I think if you're a massage therapist, then there could potentially be a number of moves that you could add into the treatment that you're doing, but it wouldn't be a Bowen treatment.
Yes. Yeah.
And
So I think. Sorry,
no, go on.
Louisa. Yes, I mean, I know that again, we've sort of done the discussion with the college as to therapists then that do, maybe a few different modalities,
Mm,
and saying that, if you're calling it Bowen treatment you're
mm,
doing, then it needs to be Bowen. You need to make sure that you're giving the breaks,
yeah,
etc., because
yeah,
that's what Bowen is. But it's very difficult, isn't it? Because I think we're all unique therapists. You can all do the same
yes,
training,
yeah,
but your background sort of brings together
yeah,
what you do. And I know for me personally that I ended up a couple of years ago doing my Reiki 1 and 2 because I would feel heat and tingling, and I said to a work colleague, well, what's this? What am I feeling? Because everything for me had been so practical with my nursing, and then Bowen being hands-on, and it was just like, why am I feeling this? What is it? And I did some spiritual development classes, which were quite good. But then I did my Reiki, and I don't advertise I do Bowen with Reiki, but actually
yeah,
it's there. So
yeah.
you can't actually say, right, do you know what, Reiki,
No,
don't don't come out here because it's
Don't come
Bowen
out.
that I'm doing. And, it just
Yeah.
does. So I think that's where, but then I think, when you go and you start working, particularly if you work in a clinic setting and you're working alongside other therapists, if you're running a clinic, you could have, two, three, four therapists that all do the same modality,
Mm,
but actually are all really busy because they work in slightly different ways and
absolutely.
their
Yeah.
personalities are
Yeah.
different
Yeah.
and they attract different clients.
Yes. There's room for every different eventuality. I always say to our students at the school that it's very much about adding tools to your toolbox.
Yeah.
You are the toolbox, and it's not just one size fits all. It's very much a case of using a bit of this with a bit of that for the client you've got in front of you.
Yes, yeah,
Yeah.
because I think Louise, you're right. Somebody can come in to clinic and sort of say, right, I would like to do massage or
Mm,
reflexology, or I feel like I need acupuncture. But actually, you might need that initially, but then
yes.
it comes
Yeah.
out, well, do you know whatever's going on is actually being caused not by a physical, but because you're so stressed out because
Yeah.
you're running around after your granny who's got dementia, and then your mum's losing as well, and
Yeah.
then your children are going through a difficult
Yeah.
stage, and you're there, and you've got pain in your shoulders and neck, you
Mm,
need acupuncture, but you get the relief. But actually, if you were to just go and have some help on the
yeah.
emotional side,
Yeah.
so yeah, it all
Yeah.
interlinks, doesn't it?
Yeah. And I always, the other thing that's really important is that you don't have to do it all or be able to do it all. And I'm a big believer in collaboration, which is one of the reasons that we're doing this sort of series, is that we can't, to our clients and to our therapists, we can't teach them Bowen, but actually I know a woman that can. So it's
Yeah,
that's
come
sort
and
of
join my course.
yeah, yeah, sort of a
But
woman that can, which is what we want. So, if people want to come and find you and have a treatment, you're now in Ongar in the most amazing clinic setting, which is just so lovely. Um, Tell everybody where you are and where can they
so
find you on social media, and
okay,
I'll put the link in the description.
okay, lovely. Thanks, Louise. So the clinic's called the Heart of Holistic Health, and we're in the High Street in Ongar. And so yes, we've got 5 treatment rooms, which is really nice. And they can find us on social media at Heart of Holistic, and we're on Instagram and Facebook. We've also got our website as well, which is heartofholistic health.com. And yeah, so, please come and follow us. That would be great. And, come into clinic. You can actually call our telephone number, and email address is on everything as well. So yes, you can contact. We've actually got a newsletter, our first newsletter, very exciting, coming out
Oh,
this week. So you
fabulous.
can subscribe on our website, which will be good.
And from a training point of view, if there are any therapists that are watching this and they feel that they would like to become a Bowen practitioner, you can train them as well.
Yes, so I can do. I can do. Louise, I've got my first module 1 actually coming up at the end of September. So, and it's here in Ongar then, in the clinic, which is really great, so
Yeah,
that we can use our upstairs, which is as a training area. And yes, it's 3 days. So all of the modules are 3 days, and module 1, and then at the end of November, module 2. Between modules 1 and 2, there are case studies to do, and which is great. 10 clients, and you have to do a minimum of 3 treatments on each of them, and you're given guidelines and obviously help,
yeah,
etc. I'll be there, helping through that. And then module 3 is beginning of February, and module 4 is beginning of April. And
mm,
then actually module 5, for that it's the 3 days, but the first 2 days are kind of with our senior tutors of the College of Bowen Studies,
yeah,
or with our director. And it's basically going over everything from the 4 modules Julian's great, as are the other two tutors, because we've all learned his experience
Yeah.
from his research and dissection, etc. So he adds on a lot more information for them, and then their final practical and written exam on the third day of that module 5. And what's really nice as well is that you can pay for your modules as you go along. So
Ah, okay.
modules 1 to 4 are £450 per module,
Yeah,
and then the module 5 is 500. But
yeah,
yes, it's quite nice. You can pay as you go along over and above that
yeah.
whole chunk that
Yes,
it's quite hard to find in
exactly,
our pot of
exactly.
money.
And so really you're looking at probably around about 12-month process.
Yeah,
Yeah.
I would say so, because actually you need to do also 10 more what's the word I'm looking for, case study, actually.
Exactly.
10 more
Yeah,
case studies between modules 3 and
yeah,
4,
yeah,
and with those it's 5 treatments, minimum of 5 treatments per person.
yeah.
So yes, you're looking really at 12 months to do it in.
Can you charge for your treatments, your case study treatments?
mm.
A little bit?
Yes, I mean, I guess you could do, as long as you've got your student insurance,
Yeah.
and yes, you're actually, people are understanding it is a
Mm.
case study. Then I guess you could do. It's not something that's really recommended, but um, I don't see why not. I mean, it's
What
really
I'm thinking about from a sort of a cost perspective point of view is if there's anybody who is really concerned about the costing, but they've got quite a large network of friends and family, that they could actually say, well, you can be my case studies and you contribute a little bit. And what that does is it actually pays for the training.
Yes. Yeah.
So
I
that
do you know what?
yeah.
I do agree with you, Louise, and I don't think it's, whilst it's something that the college doesn't advertise out, and maybe it's something I should go back and suggest to
Mm.
them actually. But I agree with you. I don't see why not, because the person that you're treating is benefiting.
Yeah.
It's like going to the hairdressers, isn't it? When they've got students,
Yeah.
and it's a student, but
Yeah.
it's going to be that much cheaper.
Yeah.
So, if you come out with, one side just a tidgy bit shorter, you don't really notice, well, hey, but normally it's not like that, because, they're being
Exactly.
supervised.
Yeah.
And again, with the case studies, we're very much, as tutors, we're very much on hand, that they can
Yeah.
contact us about anything they're
Yeah.
not sure about.
Yeah. And you can't do any damage, harm.
No, not really. I think the guidelines that you're given, where it is very gentle, it's not as though
Mm.
you're going to do a forceful, manipulation on
Not like you're
anyone.
injecting somebody or yeah, so
No,
manipulation I can imagine would be very, very difficult to do safely without any supervision.
yeah,
But we do the same for reflexology, massage and facials, and actually you can't do any damage.
no,
And actually a lot of our clients say that the treatments that we offer in training are far superior to the ones that they get on the high street anyway, because our students care so much about getting it
yeah.
absolutely right.
Absolutely right.
Yeah.
Well, do you know what? I agree, please, because it's
Mm,
that fine tuning it, isn't
mm,
it? So that by the time you come to take your exams, you're spot
mm,
on with everything, and you are really good. And
mm.
for me personally, I really like student. Well, once you, as therapists, people that are doing CPD regularly, because I just think we all need to keep
Yeah,
on top.
yeah,
And
yeah,
very interestingly, for me, going back and training to be a tutor, it was
yeah,
great, where I qualified 14 years ago, and obviously I've done workshops on top, but it's added on, more tools in the box to my original
yeah.
Bowen. So for me, it's been really interesting
Mm,
actually revisiting, stripping everything back,
mm,
and making sure I'm spot on those basics, which I
yeah,
obviously need to be
yeah.
teaching students. So
Yeah,
yeah,
I always used to find that whenever I taught a new discipline, my treatments in the salon would be better because I was paying more attention to them. So yes, it's good.
yeah,
And
yeah,
absolutely fascinating. Thank you, Amanda. And certainly from my point of view, it's something that I would be very interested in doing. I've got too much on my plate at the moment, but it's definitely something. And also, I think from a physical point of view, it's not as a physical treatment as massage, is it? And that's one of the things that I know a lot of my age group of therapists, they're actually wanting to cut down the amount of massage that they're doing because it's so physical, whereas Bowen isn't. It's much more gentle. So yeah,
Definitely. I've seen that actually with,
yeah,
I've had a few massage therapists coming in and just saying, please, my shoulders and my
yes,
hands, and exactly, you
yeah,
haven't got that. Or even, if you're doing a deep tissue massage,
yes,
it, it's a
yeah,
lot of physical work.
yes, it is.
And
Yeah,
yes, and Bowen, it's just, if you've got a long day in clinic, it's just, yeah, it's just about standing on your feet and for that length of time. But it
yeah,
is, it's much less
mm,
energetic.
yeah, yeah. Fabulous. Well, thank you very much, and I wish you all the best with the Heart of
Thank you.
Holistic. It will just go from strength to strength to strength.